Hi everyone. Imagine slowly losing your vision even without realizing it. That's exactly what happens with glaucoma, often called silent thief of sight. Glaucoma is a group of disease that damages optic nerve, usually due to increased intraocular pressure, and if untreated, it leads to irreversible loss of vision. Hence, there are few initiatives to create awareness about glaucoma. Few of such initiatives are World Glaucoma Day or World Glaucoma Week, which is usually organized during 9th to 15th March 2025 in this year. The theme of this year 2025 is See the Future Clearly. This emphasizes on early detection to prevent visual loss, regular eye examination for proactive care, community education to spread awareness. And hence, let us see what is the incidence rate of glaucoma in world and in India. Globally, glaucoma affects over 76 million people, and this number is rising day on day. Likewise, in India, approximately around 11 million people aged around 40 and above are affected with this condition. Among these, there are two types. One is primary open angle glaucoma, which affects around 6 to 7 million cases, and primary angle closure glaucoma, which affects around 2 to 3 million people. Shockingly, 90% of the glaucoma cases which get diagnosed are incidental, and this highlights the need for increased awareness. Let us see who are at high risk. The people over the age of 40 and those with family history of glaucoma are at a high rate risk of more than 4 to 9% than the normal population. People who are diabetics, hypertensive, and individuals with myopia more than -6 diabetes, and also the patients who are on long-term steroids, especially topical, are at higher risk for glaucoma. Are there any early signs and importance of early detection? Yes, there are good number of early signs which one should be aware of, because glaucoma is progressively silent condition where the loss of vision would be of peripheral in nature. By the time the central vision is affected, the damage is permanent, and certain warning signs should be blurred vision or difficulty to visualize in dim light, if the patient observes halos around the light, or if there is frequent change in the glass prescription, or especially in case of angle closure glaucoma, if somebody experiences excruciating pain in the eye, headache, nausea or vomiting, should be considered as early signs and should visit the ophthalmologist as early as possible. Those were the signs. And are there any symptoms? Symptoms are there, but they are not clearly identifiable. Since symptoms appear late, early detection is the key. So regular eye examination should be done, which includes measurement of intraocular pressure, which we call it as tonometry, and optic nerve evaluation using OCT or fundal examination, and visual field testing. Can glaucoma be prevented? Yes, glaucoma can be prevented, but it would be difficult for us to cure the condition, and hence early detection we can prevent the significant loss of vision which may not affect the individual's routine activity. So how can it be done? People around the age of 40 or who are above the age of 40 should have regular eye examination every 1 to 2 years, and the population with high risk should get their eye screened yearly. By this, we can go for early detection and we can prevent the progression of the condition. Along with that, the vision loss can be prevented if the patient adheres to regular medication as prescribed by the ophthalmologist. And also, it is very important that the individual should adhere to their regular follow-ups with the ophthalmologist, because missing medication or skipping follow-ups can lead to permanent blindness And hence, to manage glaucoma effectively, one has to stick to strict medication and go for routine eye examination, and he should have healthy lifestyle choices. So, to conclude, glaucoma is a sight-threatening condition but preventable blindness which is in our control. Let's spread awareness and encourage routine eye checkups for everyone, especially those who are at risk. Hence, do visit SDM Ayurveda Hospital, Hassan, and utilize the resources available for diagnosis and management of glaucoma. Thank you.